Okay, so we will get started. Thank you everyone for joining us for the Bureau of Developmental Services Rate Structure Work Group. We have some attendees in our rate from the Bureau of Developmental Services, as well as our representatives from M&S Consulting, Leslie and Krista and Martin. And we're going to get started today. Leslie, or would you like to kick us off today? And we will jump in from BDS as we go through the presentation today. Thank you, Leslie.
Yep, thanks, Lori. So today's agenda is we are going to go through the draft cost report, kind of show you some of the updates that we've made, see if you guys have had any feedback from the last time that we met or any additional things as we go along. And then we'll talk about next steps. Please remember that this rate setting work group is open to the public, and you can ask questions through the chat feature throughout the meeting. This allows the department to engage, you as stakeholders in this dialogue and provides transparency and general updates to the public. If you are a member of the public and have questions about the work group, please contact BDS at dhhs.nh.gov and somebody will get back to you. This is also being recorded. So we kind of went over this in the last rate work group meeting, but the annual cost report is currently under development, and it's going to be used to collect cost information and other data related to services and administrative activities provided through developmental services. These annual cost reports are to provide historical information, so what happened during your previous fiscal year, in order to do data analysis and comparisons on a year-to-year basis as the state moves forward. The cost reports are not used for any projections, so not to project any future costs. The anticipated timeline for this first year cost report, we talked about this at the last work group meeting. We're talking about it today. Right now, we are scheduled to present at the August 13th provider meeting. And then the August rate work group meeting, we're thinking that we'll still have some discussions there. Right now, the cost report is set to be released in September. The plan is to allow 120 days for completion, which would make the cost reports due in January of 2025. Today's discussion will start once again with the expenses tab, walk through the changes that we've made, see if you guys have any feedback for us. We'll talk about the hours tab, revisit that. We'll look at the revenue tab, and then also kind of talk about the summary section that we're thinking about, see if there's feedback for items to include on there that maybe you guys would like to see. And then depending on timing, we can go through a few of the other worksheets as well.
So Leslie, we have a question from Sue.
Yep.
Thank you. I'm just curious if there will be a draft of the cost report sent out to a group of individuals for some testing before it's fully goes out, like in September, whatever the time frame is.
That is the plan. Yeah, not exactly sure on timing yet, but I'm hopeful that we will. I'm hopeful that we're going to have a really good final draft before the next rate work group meeting. That's the hopeful plan. And so we'll kind of, make a plan around that. And yeah, we're hoping to do that.
Thank you.
Yep.
Just to jump into that, Sue, which I'm really glad that you asked that question. Our goal is to really make sure that folks already understand how to complete it. So we will, the timeline that was set up today is really open for, adjustments as we go through it and, determine when it's finalized and get the feedback on it. So thank you.
As for the August 16th rate work group meeting, The plan is to continue cost report review, and then I guess depending on how much we have to discuss and how that goes, if there's time, then we'll start discussing the draft DD waiver rates for specific services. So, okay. I'm going to switch over then to the actual cost report. What you should see up on the screen right now is the expenses tab. So changes that have happened since the previous meeting. We have added a few columns over here on the right. So for specialty services on the previous cost survey for 2022, we just had one column for specialty services. It still did include the therapeutic behavioral and the training and development, but we had them combined. We've now separated those out into separate columns. We still have the FMS DADS intake eligibility. We now have this waiver admin column, and the name of this is still like, well, this is all still draft, but kind of still being discussed. But what this allows is for the administrative salaries and wages section, because we're not expecting you to be able or to deviate the time for like those non-admin activities. We're not going to have you, all of this is blacked out over here. So we're going to have you put everything else kind of over in this column. These will probably also be blacked out. So the only things the only cells you'd be able to put anything in are FMS DADS, intake eligibility, and then this waiver admin will kind of be the catch-all for that admin. Normally with admin, if I were to scroll down to the expenses, the non-wages section, we have that all blacked out. We're just going to have you put in your administrative expenses for that line, and then that's it. But because we have the FMS DADS and intake and eligibility for the staff up here, we can't do that for wages. So we'll have that section there. And then you'll see that we have 3 columns now over to the right. So there's still that other programs column, but now we have BDS contract services, and then we have other Medicaid services. So BDS contract services, we're going to have you put the expenses related to those contract services in that column. Other Medicaid services is going to be, like CFI waiver, if you have services under the CFI waiver. We, talked about state plan services, things like that. Also pass through. So your pass through services, eMods, assistive technology, wellness coaching, things like that. Those would go in this other Medicaid services column. And as far as the pass through, I'm going to scroll down. There's this line called service pass-through payments. We're actually going to want you to put all of those for all of those different pass-through services other than respite would go right here in this cell right here. Respite will have its own column, just like it did for 2022. And then other programs, that's going to be your non-Medicaid books of business. So I know there's a provider that has like a farm. I think there might be, one that has like a bookstore. So these are kind of those non-Medicaid activities and books of business that you have. You would put that here in the other programs column. I'm going to unhide another worksheet quick. This questions tab, which most of you would have seen previously. We've made some changes to this and removed some things, but in the previous survey, we did have a question, and it's still here, to identify those services that were in other programs. So right now we have a question to say, okay, what are those specific Medicaid services other than the ones that we have separate columns for? just let us know what they are. So is it CFI waiver? Is it, pass-through services? Which pass-through services? And we did give some examples in that explanation there. And then down here for other programs, to identify, what those other non-Medicaid services are, just to help validate and kind of, okay, yeah, we have something in that column. Oh, okay, that's what that is. Not necessarily have to break it out or anything, but it kind of at least gives that information. Suzanne, I saw a hand come up.
I'm sorry. So if this is a level of detail that's too early at this point in time, so as an agency that provides Medicaid services for other books of business beyond CFI, so like behavioral health, for example, or ABA services, that would be something I know in the past versions we put into other programs.
Yep.
That's, I think, what I would look to do rather than other Medicaid services, because it's a level of breakdown that I don't think makes sense or is important for what you're looking for here.
And that's,
It's just something to think about as.
I guess as long as what you like over on the questions tab, you've said, like, I guess what it is you're including in which column.
Sure.
That, yeah.
Thank you.
Yep. And I will, once we go to look at the revenues tab for pass-through, there will be a line for pass-through revenue. So we've got the one line for service pass-through payments or expenses that are going out. And then we'll have a line for the pass-through revenues as well when we get over there. I think the other changes that have been made, we did, break out a few of the different categories, position categories under admin. And I think we moved payroll taxes and employee benefits down on the worksheet. On the 2022, we had done an allocation of those payroll taxes and benefits to the wages sections down below. So we had included it at the top. We're no longer doing those allocations within the cost report. So we moved that down. And then, yeah, I think we are still kind of in the process of, what lines are we going to have for the different expenses. We did break out the transportation. So we have a separate transportation section now that's all on its own. And that is because transportation is a component of some of the rates that we're looking at. We're being transparent about there being a transportation part of that rate because it's part of the actual service provision for that service. So we're separating that out of what was program related expense or even admin in some cases. We then do have the program related section. These non-waiver expenses. So if there are non-waiver or other program related expenses that you have, those other books of business that we've talked about, and what your expenses are for that other book of business, don't necessarily say it's insurance or it's this or it's that. You can just put it all here. And then whatever applicable column it needs to go in, that's where that would go. Participant wages and benefits, that would go here and would go in whichever, whatever that applicable column is as well. Then we have the room and board expenses similar to what we had in the previous survey. And then we get down into the administrative expenses. And I think I mentioned this last month, but I have gone through some of the trial balances that we received back in 2022. Kind of, okay, what accounts were there? Where did we see it? What questions or what, things when we were doing our analysis kind of showed up that we questioned or that we thought, yeah, maybe that should move around. So we're still in the process of kind of fine tuning kind of where these are. And we also are trying to kind of make sure that if there's an expense that could apply to administrative versus program related, kind of talking through those and saying, okay, is it really important that we have it in both places? Do we want the organizations to allocate expenses between the admin section and the program related section? Is there really a benefit to that? When we look at the rate methodology and we look at admin expenses, we're looking at admin as a percent of total expense. And when we look at program related expense, is at a percent of wages. And so if you have organizations that are carving certain expenses out and moving them up in program, but you have a lot of other agencies that aren't, we're just not sure kind of if that's actually going to kind of hinder things. So we're still kind of working through that. So I guess if you have any specific examples where you're like, yeah, no, we would really, this expense really needs to be in both places, let us know. You can email us at that NH cost report at mslc.com. And we can kind of walk through that, because we're trying to make this kind of as clear as possible and not have you doing a bunch. You're already going to have to allocate expenses between the service columns, between the services. We also don't want you to have to do a bunch of allocations between cost sections. So, and, salaries, there's already going to be some, some allocations of wages up in those sections. So trying to make it a little bit clearer down at the bottom. Any questions?
So this is Lori. I just really wanted to encourage some of our participants to ask your questions. You might be feeling like you don't want to ask the question because you're not sure. But that's what we're here for, because we want to make sure we get a good product out to you that you understand. So if there's anything that you're thinking of asking but not sure, please do. Thank you, Leslie.
Yep.
Because I ask a lot of questions, so I want others to thank you. We have a question. Shelley.
So
Hi, Shelley.
I guess I just would like clarification. You said initially that this data was going to be used for analysis and historical information. I mean, what does that really mean? What kind of analysis? What are you looking for? What are you going to be doing with it?
So at this point, Shelley, we're working on that. The original cost report, as you know, that we did was to help us develop rates going forward in the future. At this time, we are meeting internally to determine the actual various uses of this cost report, and we plan to get out some messaging about that in the future. But it's a very good question, Shelley, and thank you.
As Krista and I are going through, what we're doing from the standpoint of, we've now developed this draft methodology for each of these services. Okay, what's the information that can help? So, if 3-5 years down the road, the state does do a rebase, the information's already here, and you've already been doing it, you've been doing it annually. So you've looked at your accounts, you've kind of already, made changes, knowing what's going to be expected. And so we don't have to go through what we did back in 2022, build a brand new cost report, kind of do all this stuff, because the data is already there. So as far as us building it, that's kind of where we are. We asked a lot of minutia and a lot of detail about services in 2022. Not all of that's needed now. So that's kind of where our heads have been as we're building it, is to help down the road with the methodology, and knowing now, kind of what the proposal has been, or kind of where the draft sits right now with the methodology. is also helping us kind of, steer what we're doing on the cost report. Okay. One of the other things I think I mentioned last month is the cost report is no longer going to have macros. So, which is good at, pros and cons, because I know the macros kind of, some providers had issues with the macros, getting them to work properly, and making sure that they would run. But not having the macros does mean that you have all of the columns and you're going to have all of the worksheets, and it won't hide things. So kind of, positives, negatives there. So because we don't have that right now, what we're looking at is that we would still have the services tab. So I'm going to click over there. So the services tab. So you can see right now I have all these different ones X'd. So if you select a service over here, what's going to happen right now is if you don't select that service, you can see that service coordination, respite, and supported employment are all blacked out. That's because those services aren't selected right now. But if I were to go in and select respite, come back over here to the expenses tab, respite's now open for you to enter data. So that's kind of the plan right now. And that is the case if I go to expenses other, it's the same. So that would be on any worksheet that kind of has these services over to the right. Kind of that's the plan. And then if an organization wanted to go in and hide, those columns, they could do that, the ones that are blacked out, or just, leave them there. But we're kind of hoping that that'll help a little bit since we can't hide the different columns. So I've been working on all that conditional formatting, making sure that it's working appropriately. And like you can see down here too, like we're kind of planning to, black out different sections that won't be needed. Just once again, trying to make it, as efficient as we can as you're filling it out. Also getting the informational icons updated as far as wages when it comes to the different categories. Hoping to put in kind of some example position titles. We've also discussed having kind of a supplemental kind of attachment to the cost report that will, kind of, give position titles for these different things. Once again, just kind of as a guide and a help as you're filling out the cost report. I think Suzanne, I saw your hand up.
Yeah, so this is hard because we're just seeing screenshots rather than having the full thing. If you could go up a little bit, I think I saw in one section you had something like maintenance or and it said directly to housing.
Yeah,
Oh,
general facilities
facilities and-
maintenance
Yeah,
related to client living space.
So that would also be a category for some providers, that there would be general facilities and maintenance to like CPS program space. So just it's not necessarily just related to client living space. I don't know what again, it goes back to Shelley's question, and I think a question that's been asked for months. What are you exactly doing with this information, so that we're just giving you the most accurate information? And I think, go ahead. I'm sorry.
No, go ahead.
I was saying, once this is fully defined, I mean, you're asking us to break down information for a fiscal year that's closed. Ideally, we'll have, if this is an ongoing report that's defined, there may be some agent, I'm going to speak just for my agency, we may update how we're categorizing information.
Yep.
So in the future, it makes this type of report easier.
Yep.
So having it ahead of a fiscal year would really be great.
No, and yeah, we completely understand. And we also understand that, whatever that first year is that you guys are filling this out, I mean, it's going to be what it is, right? And
Right.
the hope is, just like you said, we
Yeah.
actually want you to say, okay, this is what the expectation is going forward. What changes do we need to make? What's going to help us out? And it's going to be a work in process. It always is. We have that in other states that we've worked with as well. So that's, yeah, we completely get it.
Mhm.
As far as the facilities and maintenance, so I would say, and we will be clear about this in instructions, like we're gonna try as good as we can. So general facilities and maintenance, we could add a separate line up here in administrative salaries and wages. But also it could go in office operations. And that would go just as an admin
I think the question is,
expense.
how are you breaking out what you're calling office operations for an agency that provides services as well? So there's office operations, like if I'm sitting up here in our office versus downstairs is a provider day program. So I think when you think of agencies that do many, many things,
Yeah.
the level of definition is really important.
Yeah, so when it comes to that general facilities and maintenance, they would be they would be looked at as an administrative category. And so we wouldn't have you break that out by service, except for that kind of room and board piece. So if you can separate out, if you have specific facilities and maintenance staff for those client living spaces, which is technically room and board, which is not reimbursed by waiver and not included in rates, because it's done separately. That's why that's being carved out specifically. And that was carved out on the 2022 survey as well. It just looked different because we had the staffing tabs, but it was carved out separately.
It'd be interesting to look at your categories here and what categories are in the budget under the non-personnel section and how those two relate.
Sorry, I'm writing notes. Okay.
Sue, can you expand on that for a little bit for me? The
Right,
in the
so-
budget that you present as a provider, is that what you're talking?
Right.
I just want to make sure I'm hearing you.
There's
So
a
yes,
there's a
okay.
section
Mhm.
in the
Yes.
budgets under like residential,
100%.
SCP, all that,
Yes.
that says program costs and it says
Correct.
rent /
Okay.
mortgage, R&B,
Yeah.
utilities, maintenance,
Yeah.
all that
Okay.
stuff.
Yeah. And that might be, to give a very specific example, it might mean that you have a dedicated room in the home for medicines and med administration. So you're saying it would make sense if we, it would be easier to complete this if that lined up with the cost report.
It
Am I-
might be. I mean,
Okay.
it's
Okay.
how is the
Yeah.
state looking at these type of expenses? And
Okay.
is similar and different.
Okay.
structures.
Thank you. I just wanted to make sure I fully
Yep.
Yeah.
got that. Thanks, Sue.
Is we do have the separate room and board section for the non-wage expenses as well. This is really the only wage up in the wages section that applies there, and that's, I don't know if we've received any kind of newer budgets. I know we've looked at the Form B and those different forms that we've kind of been using that to kind of help us out. But we'll this is definitely something still in process. And then once we get, good, we'll kind of work on those instructions and kind of get those as beefed up as we can as well. I did want to point out again, the other lines like here, these will be hyperlinks. So when I click on this, it's going to take me over to this other worksheet. And so you have this expenses line 6, we'll have these numbered. Haven't put in the numbers yet, but we'll want you to put in, you had this expense, you didn't feel like it belonged in this other category, or you just wanted to be able to separate it out. You can put those in here, and then you'll go in and fill out over here to the right. That total then will populate over. If I click on this, it'll go back here, but it will then populate on this line. You can see that it's the darker blue to let you know that it's a formula coming from somewhere else and not an expectation to key it in. So that will be a functionality between these two worksheets for each of the other lines. And if I click on this one down here, then it'll take you down to this section for that section. So a little bit different from the 2022 and kind of how we're looking at those other lines. And we'll have the same columns as the expenses tab. If it is going to black out, it'll black out the same columns and sections. Okay. I'm going to go over to the hours tab. Really on the hours tab, the same changes that we've made. We have the additions to the columns. I do on the previous cost report, we had those staffing worksheets, and that's where kind of these informational icons for the different columns were located. We didn't have these on the expenses tab. They were on the staffing tab instead. So the informational icons here for these services, there really isn't a lot of information. It's just like, hey, here's where you should put hours for CPS. But as we get down into, the BDS contract services, the other Medicaid services, those informational icons will have a little bit more information, pass-through services, specialty assessments, evaluations, consultations. This is kind of what the expectation or examples of what we would expect to be in this other Medicaid services column. And then this would kind of be your other program services not related to Medicaid. So trying to beef up those informational icons just as a, another point of information along with the instructions that we'll have, over here on this worksheet, which have not been updated yet. So they're not applicable right now. And then there will be an instructions section also up here at the top. Right now it's kind of hidden. It's much larger, but those will all get updated and beefed up as well. And then same as what I showed you earlier, when you click on the other here, it'll take you over to that other hours tab. So really expenses, hours, the other tabs, they're all going to function the same way, same columns. As far as the hours, all those wages section up at the top will all be the same. So whatever lines we have on the expenses tab will also be on the hours tab. We also do have the section for contract personnel and stipend. If you do have the hours for those, to go ahead and put those in. I'm going to move on to the revenues tab. So as far as revenue on the 2022 cost report, we kind of had a really small revenue box on the services tab. So we had you select the services, and then we just had this little section where we had the different services and kind of had you put in what your total revenue was there. So now we're looking at it more of what were your revenues on your trial balance here, and have a worksheet where you can enter those in as a whole. So in the expenses tab, we're wanting all of the expenses to add up to what's on your trial balance or your profit and loss statement. Same thing here with the revenues. So we have the service revenue. You'll see all the different services that we've included. And then we also have as columns over on the expenses tab. We do have a specific one for dad's revenue. We have a room and board revenue, and I'm going to click on the informational icon here. So revenue related to client living spaces. Try to kind of give some examples of account names that I might have seen on trial balances. That pass-through revenue that I talked about a little bit ago, other than respite, because we have it separated up above. So I have that being included on line 6, but this is where kind of all that your pass-through revenues would go. And once again, in the informational icon, tried to kind of give examples of all those different services. So your specialty for assessments, consultations, evaluations, mentioned wellness coaching earlier, community integration, PERS, kind of, those revenues would go here. Your
Leslie,
contracted, yep,
this is Lori. I'm sorry, I'm just jumping in with a clarifying question about specialty services assessments. I did see that you listed them off under other service revenue. But I have two comments, I guess, that I want to clarify.
Yep.
Sometimes if I am a specialty services provider, I could bill assessments directly. It may not be a pass-through.
Okay.
Or they could be a pass-through. That's one area that could be one or the other. I
Yep.
just wanted to bring that to your attention. So say I was a specialty services provider completing this. The 3 ways I would bring in revenue would be behavioral, the training and the development, and then the assessment. So I'm not sure if we would need to list that for them, or they would just capture that in other service revenue. It's not a rate-based service for assessment. It's, the cost of the assessment.
Yep.
Just food for thought in case I confused you on that one.
No, and it's one where, if we just have to be really clear that if it is pass-through revenue, this is an example of pass-through revenue, so I don't want to not include it because it was in the list. It was in the list of pass-through services that you guys gave us, so I tried to
You're correct.
Get it in there, and then if we just have to be call it out, try and call it out in a specific way in the larger instructions.
Thank you.
Because I know in this informational icon right here, I was just happy that I was able to get all of these really large words, because there's a character limit, and I was like, okay, that's why NEMT and PERS is how it is. So I could get them in there, but so in the instructions or however we do that, is that where we kind of beef it up, and then down in other Medicaid services revenue, do we also include it as an example down here? So we can talk through that.
Thank you.
So yep. So then your contracted services revenue, your other Medicaid service revenue, your other programs. So just like we saw the columns on the expenses, here's the lines. And then we do have the other services revenue, which once again, that'll be a hyperlink, which will take us over then to this other worksheet. Go back. So then we have the other non-operating revenue. So here's kind of, we saw, grant revenue, sales, rental income, production, service income. You saw some intercompany. We have your restricted and your unrestricted. So donations, fundraising, contributions, investment interest, management contract, and then once again, other. So this is kind of, I tried to look at what accounts did I see most prevalent amongst a lot of different providers that we received back in 2022. There were some one-offs that, we saw, but we kind of think that those will go down in this other, as you click the other non-operating revenue, and they'll come over here. So try to include those categories that we felt like were utilized and really needed. And so we would just want you to and tried to keep them, like, I guess, as larger categories as we could, right? Because we don't need you to kind of like break all this out and detail it out. So But give you a place to put that in there so that you can tie to your trial balance easily. I know I think that was a question that we had last month, especially for those other programs on the expense side and on the revenue side, that you could just pop those in there. Is any questions on the revenues? We know as far as billing that there have been some kind of delays for some providers as far as billing for this last fiscal year. We've kind of talked about, you know, we do want this to tie to the trial balance, but do we want, you know, information as far as, you know, service revenue that was done, but maybe not billed yet or not received yet. So we're kind of still discussing that, if that will be part of the cost report or not. So I guess, once again, something to kind of think about, if there's anything around the revenues that you feel like we're not taking into account or you feel like would be helpful.
Can I just throw in one thing there? So from a accounting standpoint, there should be an accrual for revenue, even though it's not billed yet, if that's something that is out there. And that should be in the trial balance that you get from folks.
When you do the accruals, do you do it as one lump or do you do it by service?
We do it traditionally by service for consolidated services in a lump. But again, I'm just one agency.
Yep. Nope. Yep. So we'll talk kind of what we want to do instruction wise there, because I think if you had an accrual and you have it by service, I would actually want you to include that accrual up in that particular service revenue line. Or if it is a lump, yeah, is there a line that it could go in? And if there isn't a line that it could go in, then I'd have you put it down in other and put your accrual over here. But that's kind of just where my head is right now. But it's something that we'll dig into a little bit. Okay. So I'm gonna talk about kind of the summary. So we're planning to have kind of a summary tab, and how we've envisioned this is, there are different things that would be helpful to see kind of on one worksheet. And, you know, when I think about how we're looking at building rates and a rate methodology, you know, we have a benefits percentage, and that benefits percentage is as a percent of wages. So on that summary tab, do we actually show, you know, here's the percent of payroll taxes and benefits to wages as you've entered them on the expenses tab. And so you could go and you could look at that and you're like, that doesn't, like, that's not what we usually think of. So kind of, you know, thinking about that, or here's your administrative percentage as a percent of total expenses. So that could go on the summary tab. I guess I just kind of be thinking if there's any other calculations or if there's anything else that you would like to kind of be explicit, that as you're filling out the cost report, you'd like to be able to go and kind of use it as a check figure, or something that during the year that you could go back and look at and say, oh yeah, that's right. That's, you know, kind of what that percentage was, or a specific calculation. Because we kind of like to get some feedback and if there's any ideas of what could be helpful on that summary tab, or if you're like, yeah, no, we don't really need a summary tab. Let us know. And once again, the email address, the old email address still works, the NH cost report at mslc.com. Kind of as we move forward and getting feedback on this. Okay.
Go ahead,
I
Sue.
throw another question.
Yeah.
It's gonna be
Yeah.
the last time I'm allowed to be part of the panel.
No. So first of
Uh,
all, I want to first of all thank you, because I think some folks might not be as savvy to ask the questions that you're asking because they're on a learning curve. So I really appreciate it. So keep
Thank you.
asking.
All right. Just a quick question, and it's probably goes back to other tabs as well. When you talk about room and board, whether it's revenue or expenses, are you going to break out what I sort of call the pass-through room and board? So what individuals get from Social Security that then gets paid to home providers versus the state contract funds for, the 24/7 residential sites that get room and board from the state, so to speak, because those are two different categories potentially of revenue and expenses.
So as far as
Board, yeah.
as far as expense for room and board, we have a line that's called room and board payments. So from an expense standpoint, I would probably just put everything there, no matter kind of like who it's going to, if that's helpful, or if I'm not being, I guess,
I
clear.
feel like there needs to be some clarity on what you're looking for and perhaps some instruction when it goes out to providers.
Okay. I guess when you're, and I don't know expense or revenue, or if it's both that are kind of murky, but I guess where would you look to put those expenses?
So the pass-through is revenue coming in and expenses going out for room and board payments for what I call typical, anyone who's in, home providership type.
Okay.
So just to clarify that, Sue, I just want to make sure I understand what you're saying. I'm an individual that lives somewhere. I'm paying monthly room and board fees. You, as the provider, might be receiving it, but you're turning around and paying it to the home care provider.
Correct.
So you are, as the Medicaid enrolled provider, you're collecting it, but you're handing it right back out to the individual home care provider working under contract through you. So there's no like 1% on that. It's, I got it, I'm getting it back out.
No, and unfortunately,
Mhm.
sometimes we don't get it, but we still pay it out
Right.
to the home provider. That's really
So
Yeah.
So that's one way of how room and board works. The other way is for those few providers that are receiving additional funds from DHHS, you would, as a provider, invoice DHHS, get some additional funds above and beyond what the individual is paying, and then you as a provider may be paying that out in rent or utilities or whatever. It's not as a clean,
as clear.
it
Yeah.
clean pass through, right?
Yeah.
Okay.
Thank
So,
you.
and I guess we'll continue to talk with BDS
Mhm.
because I don't know if the clarifying issue is that like 10%. And so if we put it in the service
No.
pass-through payments line, those are only the services that have that 10%. And then,
No. So room and board is not pass through. I think we need to just
Yeah.
to clear.
So
Yeah.
that's,
There's
as
no
far as
10%.
as
Yeah,
far as
there's no.
clarification in the instructions,
Yeah.
I guess that's where
Yeah.
I'm thinking is if it has the
Okay.
10%, it's gonna go up in this line, the service pass-through payments. If it doesn't have the 10%, it needs to go elsewhere. So for room and board, we'd want you to put it down in the room and board payments.
Oh, I see what you're saying. Okay.
Well,
I
we'll
just
have
wanted
to look
clar-
at pass-through because not all pass-through has a 10%. So
Right,
that's a
so-
whole
And that's what yeah, so that's the
Yeah.
conversation we need to have with BDS. Like,
Yeah.
how
Yeah.
can we, or if it's just clear that no matter how it is paid, if it's related to room and board, here's where we
It's
want
here.
you to put it.
Yeah,
Yeah.
that's what I think we will
Yeah.
do.
And
Okay,
I think that'll be the same thing on the revenues, is if it is related to room and board, that's where we want you to put it.
does that make sense, Sue? Because it's all the same cause, room and board in, room and board cost out.
I think so. I
Okay.
mean, once we see, like,
Yeah.
actually have this in hand, then
Yeah.
it might be more questions. But,
Yeah.
but the other piece that you brought up, Leslie, as a side note, when you say all pass through with the 10% going
Yeah.
off room and board, there are other pass throughs that don't have a 10%.
Yeah, and that just wasn't, yeah, no, and that's good. So if we can just be clear on the instructions, anything room and board, no matter how it's paid, would go on this line, and then we'll figure out the instructions on the pass-through, or if they have to be any different than what they are now. But I just wasn't sure if that was a way to do it, and it won't be.
I'm going to throw one other thing now because I'm looking at, and then I'm going to stop talking. Specialty services, I think we're going to have to be careful because last fiscal year, the crossover that happened in July had the old specialty service codes, which were not broken down into like these categories.
Yep.
Remember, they were at the half-hour unit versus the 15-minute unit for a period of time. So there's going to be some challenges potentially there.
Yeah, and we can kind of make a judgment call or in the instructions, like in this situation, go ahead and put it in this line. At the end of the day, when it comes to this, as long as the organization is being as consistent as you can, knowing that like this first year, that's an anomaly that we didn't have. But as long as it ties to the trial balance and you placed it somewhere, we're good.
Are there any other folks on the call that have questions? I don't want to pull you out, but I want to make sure that if you're like, I'm confused, that you feel comfortable asking a question, as comfortable as you can being recorded.
I was gonna say, we don't have Ellen or Matt, so.
I
Shelley.
noticed you include client services and room and board revenue. I mean, client services for us is usually cost of care, so I don't know why I really want to include that in room and board.
Yeah, see, that's a really good point, Shelley, because everyone might use that label for different things. So
Yeah.
I was just trying to see if I had placed it anywhere. Yeah, I have client fees, residential fees, but not. And I know that I have seen, I think Lori, maybe we might have talked about the client services and the cost of care the other day. And I apologize. I have no power at my house. So I've had to come into an office, which I'm not normally in. That's why my background is different today.
Lucky you, Leslie. It always happens on, recording day too.
Well, and it's so frustrating because we had a tornado come through on Monday night, like literally like 6 blocks from my house, and had no problems, didn't lose power. Last night about 8:30, the power went out and it's still out, and it's beautiful here. So just frustrating. But anyway, I don't have my notes with me. I forgot my notebook. So but the client fees and the cost of care, because those are things that I saw on the trial balances. So the plan will be that we'll have an informational icon that'll be somewhere. that we can talk through. Same thing on the expenses side is that client treatment and services expense that a lot of agencies had on their trial balance for 2022. And I'm kind of still parsing out like, where does that go? What is that? So yeah, we'll look at
Specialty
this.
service. So that would be our specialty service expenses, the client treatment.
So, but that includes the like assessment, consultations, evaluations, is that right?
Those are usually under professional fees, so that would be separate.
Okay.
So say that to me one more time, Shelley. I'm sorry. What do you use for a category? I'm sorry to belabor this, but I want to make sure I'm hearing you.
I think it's like client services, client therapeutic services, something like that
Yeah.
as well. For specialty services, if we have like an ABA person come in, something like that. But
Okay.
assessment, that would usually be under a professional fee category.
So if you were to do the cost report though, and you know your client services means some kind of specialty services, you would be putting that under specialty services and not somewhere else. Is that correct?
That's what I would do, yes.
Okay. Yeah. Okay. Thank you.
Yeah.
Yep.
And
Good answer, Shelley. Good answer.
it's more from my side to make
Mhm.
sure that we have a line in like program related expense, or which section do we need to have a line and how do we want to name it, or make sure in the informational icon that one of them includes, so we can try and be as consistent as possible. And the majority of agencies are placing that expense in the same line. And that is part of us really trying to narrow those lines down, not have a lot of duplicates between the different sections, so that we can get some consistency. So as we look at program related expenses, that we don't have, a few organizations that are adding a bunch of expense up in program related that aren't on a bunch of other organizations, because then you have outliers as you're kind of looking, because the state isn't looking to do provider specific rates, just like you have now. It's a statewide rate. So just something that we're trying to keep in mind so that we can try and be as consistent as we can. Suzanne.
You keep referring to the state setting rates when you look at this report. So
Yep.
I would really like to understand what is this going to be used for and when, and how it relates to rate setting. Because you have referenced rates more than a few times in just this
Yep.
call.
Well, and I guess I look back to, we did that 2022 survey, and this really isn't the cost report, same columns, same kind of all that thing. So, that survey was used to draft a proposed methodology to do proposed rates down the road, and kind of work through that. And I know we haven't really talked through those, and we'll see how next month. Hopefully, we'll get to some of them starting next month. But knowing that methodology, hopefully, will go into place. Okay, well, you've now got this methodology. Providers are going to want to, possibly update those, down the road, and CMS, like states to do rebases and to have that. So what information?
Right. It's just understanding how this all relates to rate setting. Of course, we don't have what the rates are yet.
Yep.
What was based on
Yeah.
potentially the 22
Yeah.
reports. And it's just understanding that and
Yep.
how this
Yeah.
information
Yeah.
all coalesce to rates.
Yeah.
So Lori, I think maybe that's
Yeah.
something that we can talk about before the August meeting to,
Yeah, and I mean, really
as
good
we're,
feedback. Yeah.
Yep.
I think in the August meeting, as we begin to share rates, which we definitely plan to do, Sue, it will help to become clearer and it's been a while since we've set that down, like how a rate is built and what goes into that and what feeds that information. So I think it will become clearer as we begin to review the rates, the draft rates. But very good
Be
points.
great. Thank you.
Yeah.
Sorry, hold on, I'm writing notes.
For folks that are in that are not a participant that are on the call, I believe you can chat if you have questions or comments as well. I'm not sure if I said that before, and Jess Kennedy, you might be able to confirm that with me to make sure I'm saying that appropriately, but I believe the chat feature works. Shelley, go
It's
ahead.
enabled, yeah.
Okay, thank you, Jess.
So I'm noticing on this revenue section, and I don't remember really on the cost section, the expense pieces, I'd have to look at that again, but I'm seeing line number 4. You have residential supports, PDMS, or family home services revenue. But what about CPS revenue for PDMS? What about CIS, non-medical transportation? What about those other categories? Would we put those under other revenue and then put the detail there, or you just want the PDMS residential supports separated?
So this residential supports kind of ends up being, I guess what we've, a lot of times, 521, 525. That's what this line 4 is. So if you have PDMS, CPS, we want you to put it under CPS. And if you have PDMS, I guess any of the other, we want you to put it with that service. These 3 right here of like the residential, this, as we did the previous survey and we kind of broke out that 24/7 staffed residential, we broke out the enhanced family care, and then we kind of had this other, and so we just called it the other residential supports. But it ends up being that 521 and 525. Yes, Lori, if there's any other clarification you want to give on that.
No, actually, it's a good question, Shelley. So if we think of it, and I am just talking out loud because this is why we're doing this today. It's really if you look at the setting where it occurs. So if it's a staffed residential, you would put your revenue there. If the individual was supported in an EFC setting, PDMS or not, it would go there. If the individuals was receiving residential services in their home, 521, 525, it would go there. That was kind of where we were going with that. Does that not make sense to you?
No, the residential piece does, but
Okay.
not breaking out any of the
Okay.
other on PDMS.
No,
They're
we are
included.
not, because that is correct. That is how this is developed.
So, but
Um,
it's the only one you want broken out. And like I said, CIS,
Yeah.
non-medication, wellness, all of that's part of PDMS. But
Right. So very good points, and thank you for bringing them up again, because it's always fun in this meeting. But like like CIS is not um a rate that we're working on. Do you know what I mean? So we're not asking you to break out to that level. Residential, as you know, is a big thing for our system. So we're trying to really capture where is it happening and how is it happening. But if you have any other thoughts on that, let us know. But we are including all CPS within CPS and all supported employment within supported employment right now.
okay, so the PDMS would be
But
included.
think on that.
Okay.
Yeah.
So
Yeah.
then if we had, say, non-medical transportation, that's not it could be a pass-through service, but under PDMS, it's not. So we would put it under other program revenue or other service revenue, or other Medicaid revenue, I guess, maybe, number 17.
Okay,
So
Lori,
that's a good question. Yeah.
Lori, yeah, we can
Go
talk
ahead.
about that.
Yeah. Good
like,
question, Shelley. Yeah. Thank you, Shelley. And Sudip.
Lori, I think I'm good because I was just gonna ask you a follow-up question about why only in residential you need a breakdown. We know we have the staff residence, we have EFC residences, and then
Yeah.
residential for PDMS and family home. Likewise, do we really have to do that for CPS services? Because CPS is also another, I would say, significantly big services, for us,
Yeah.
and for
Yeah.
some providers too. So I think you answered my question. So you are saying that the reason of breaking residential services into three categories. Why are we doing that? Why are we including PDMS here again?
S- So I want to make sure. So I'm glad we're having this discussion, first of all. Um, as you know, so your question is why are you breaking out residential differently than you are breaking out the other services? Am I capturing that question correctly?
Accurate. Yeah, especially including
Yeah.
PDMS, line here. Okay. I understand the difference
Right.
between the staff residence and EFC. That's,
Right.
I
So
understand the
would it
different
be
settings.
right? Would it be helpful if we just said residential supports family home? So that's really what we're getting at because we have kind of three ways of receiving that service in a staffed home, in an EFC home, or within a family home, right? And usually within a family home, it's through 521 or 525, correct? So we're just trying to capture that, how that service, how that residential services are delivered differently. Where CPS is, um, even if it's PDMS, can be delivered, partially in a home, partially in a community. It's pretty much depending on the unique situation. And I do understand that you might have someone that's self-directing, that's partial EFC, partial home, but then you put the revenue where it belongs in that situation. Feedback, suit up, Shelley. Does that make sense? Not make sense to you?
It does when you explain it to us, but the first
Okay.
time I'm just taking a look at it, we could be confused.
Okay, so we definitely need to give good clarification on that and maybe some relabeling there.
That's what I have written down.
Yeah.
Okay.
Thank you.
Thank you.
And yeah, we'd had separate columns on the 2022 survey for these three, because at the time, I think the state had been looking at, these are different settings. It always in the past, it had come from the same rates or, how those budgets were done. And so as we've worked through, the rate study and said, okay, these different services, they really do have a different cost structure. Should they actually have a separate rate? So should staff residential have a separate rate from enhanced family care? So it's still separating it out, but yeah, definitely work on the wording of that and then also the informational icons. So we're clear as to kind of where that goes. Because like I said, what we're hoping is that we're not having to carve out a bunch of stuff that, you have this revenue, yeah, go ahead and put it here. And that you're not separating out different accounts between different lines. So however we can make that clear and consistent, we want to do that. Okay. Lori, are you okay if I kind of started on some of the green worksheets?
Yeah, I'm just checking. It's more of just checking the pulse. I still don't see anything in the chat. I just want to keep
Yep.
welcoming feedback, because the more we get, the better we do our job. So
And
please
please,
don't hesitate to keep coming off. So
Yeah.
we'll keep going. Yes.
Yep. And I'll bring up the email again, the NH cost
Yeah.
report at mslc.com. Krista and I necessarily hadn't been in the habit of checking that email, but I have the last few weeks since the last work group meeting, just in case we got an email in there. So definitely let us know. Okay. I'm going to come over to, oh, we've got another hand up.
Um,
I think you might have to put that in the chat.
Yeah, so Jeb, just to be consistent, we want to hear your feedback, but if you could pop it into the chat, we will make sure we address it. Thank you, Jeb. Okay, so we can,
Yeah, I'll go back into the chat once we see it come through.
yes.
I go over to transportation, med management. So this nursing medication management section should look familiar. This is what it had been on that last survey. And what we're looking for is information regarding the nursing staff that's providing training and supervision over medication management. So, for those nurse trainers, that nursing staff, the number of trainings that they do per year for your organization, average number of hours per training session, the number of trainer evaluations and authorizations that they have to do in a year and how long those take, and then the number of quarterly reviews meetings per year that they attend, and how many hours those are. So trying to get at, that's not direct service provision, that it's not that hands-on care, it's this separate piece that these nurse trainers do, trying to kind of understand how long that takes and what needs to go into that.
So Leslie, just to let me bother you about this a bit, because you've been very helpful in answering my question. So if I'm a nurse and I'm doing an on-site review for an individual with their staff, that would not go here. That would go under the service that I'm doing it for. It's a direct service. Is that, so I just want to make sure I capture that. So I'll give you an example. An individual might, a staff member might be med trained, but the person that they're supporting has a medication change. And sometimes the nurse needs to, well, they always need to review that new medication. So I was like, no, always need to review that new medication with the staff to make sure they understand what the medication is for, side effects, things like that. Review questions about issues with the other medications that they're taking. So that's like a direct, I don't know, I'd call it an on-site. Other folks might call it something different. Is that captured in, say, the individual was receiving CPS or residential services? To me, this category is, as a nurse, what am I doing for overall like med training? Um, you know, quarterly reviews or meetings on behalf of the individual that I'm overseeing med administration for. I think we might need to talk about this a little bit further.
Yep. No, and that's
If
I have it written
sorry.
down.
Yeah.
Nope, that's fine.
Okay. As to what's direct and what's more of a training administrative role for med
Yep.
management. Does that make sense, Shelley, Sue, where I'm going with that? Okay. Okay.
Yeah. No,
Thank you. Thank
yep.
you, Leslie.
Well, and I apologize because you had to leave early when we met the other day.
Yes,
So
yes.
yep.
And as you
So
guys
it's been a
can
while
see,
since you've seen this.
yeah. what full transparency, this is a work in progress, and that's why we're using this group to help us and give us feedback, because we want to, you know, make sure we get this right and as user friendly as possible. So,
And as far as transportation, so talking about transportation for applicable services, the number of individuals utilizing provider transportation as part of service provision. So is it part of the service provision? How many individuals are utilizing transportation? And then the number of individuals included in line one. So got everybody in line one. Now we want the number of individuals that are utilizing specialized or modified provider transportation as part of service provision. So how many individuals do we have using that specialized transportation? And then the average number of days per week that transportation is utilized per individual, and the average number of miles per day that transportation is utilized per individual. We're not sure yet. It might not be something that you guys track right now. So this might be something that the first year is, questionable. But because we talked, earlier about on the expenses side, this would be one of those other things that, kind of to start tracking. And is there anything else that you think would be applicable?
I'm just going to say, I think this is going to be a bit complicated because you could have 5 people in a van. They could be getting off at different places. So maybe the van goes 30 miles, but person A goes 2 miles, person B goes 15. I mean, again, maybe at some point in the future we can try to calculate that. But looking back, that seems really complicated in my mind.
So here's what and we'll talk with BDS. Where my head is right now is I would say this is how many miles round trip, that the vehicle took. And yeah, you had 5 people in the vehicle. One of them only might have been in this long. One of them might have only been in this long. I would say take that round trip. What was it? Divide it by 5, and that's your average. So that makes, it's very oversimplified, but that's okay.
But we need to give, what it's telling me is we need to give some examples and guidance for that.
Yep.
So everyone is interpreting the same way. Could you do me a favor and scroll over to the right a little bit more? Maybe it's just me. I couldn't see all the services.
Yeah, no, they're,
Oh, whoops. Okay.
Yeah, and this
Okay,
is one
thank
we haven't
Okay.
built in.
No, yeah,
Conditional formatting and stuff.
yeah,
So some of these might be blacked out. We haven't done any of that for these worksheets yet.
okay.
Hi, this is Kim. This is going to be very, very difficult to
Yeah,
come up
Okay.
with, maybe moving forward. I'm just thinking not so much for like supported employment, community support services, but
Yep.
like residential. I mean, people are going out and about from their homes. We just don't track it, and they're using
yeah.
our vans. I don't know how we're going to do this. I'll be honest.
Okay. Well,
So Leslie, I have a question on this. Is the
Yep.
goal, again, first of all, Kim, thank you.
Yep.
So I have a question on this. Say I provide residential supports and I put in the total number of individuals, which we have. So I'm going to make my life easy right now. I serve 10 people in staffed residential homes. And let's say one of the individuals requires specialized transportation. And then what if so you're just saying instead of per individual, could we use the data as total, how many require specialized? Maybe even the specialized transportation total and then the rest total of miles, just total miles? Are we gonna,
we can talk about it.
Okay.
Because I want to kind of talk through.
okay, what it would give us? Okay.
Yeah, like Suzanne was talking earlier, like, what are we gonna use this information for?
Yeah, right.
Whatever. That's the,
Okay.
yeah,
A key
how
factor.
are we going to utilize
Right.
it? And is that, and
Yeah.
knowing that,
Yeah.
this would be
Okay.
difficult for them to get. So then
Yes.
it's like, okay, is there something, is there a different metric that we can get? Or for residential, is there a different question that we can ask? So I think we just
Yeah.
need to work through that. So
Yeah.
I'm glad that we had time to touch on
Yeah.
that today.
Okay.
Yep. Okay. So yes, I've got some notes
Any
written
other
down.
comments on transportation? I just have a question for some of the providers. I'm going to say something and it could not be true. You probably could say you know the number of individuals you're supporting and you would know what your cost is for residential transportation. Would you know what your cost is for specialized transportation over, I'll call it passenger vehicle transportation?
Can you define specialized transportation?
Yeah, so that's a good question. So I'm going to give it my best, Kim. So in my mind, specialized transportation would be an accessible wheelchair vehicle or a van that may need to be utilized for someone that requires that might have some behavioral support needs where you might need a bigger distance between the driver and the passenger. So that is my quick definition. If I can send a staff and the individual can pop in and out of my staff's car, even if they use a portable chair, I would not call that specialized. So my definition would be an accessible vehicle or a special or a larger van because of, maybe there's two staff with the individual or some behavioral support needs for distancing.
Okay, that makes sense, but what was your question again?
I don't remember either. My question is, would you be able to give us these are the total number of individuals we serve for this service. These are the total number of individuals that required specialized transportation, which I really hope you could give me that because you'll know.
Yes.
And these are the total individuals that could be transported in a typical passenger vehicle. And this is my total mileage for specialized. This is my total mileage for non-specialized.
Yeah, that probably could be more easily obtained.
Okay. Okay. And I'm not even sure. So that's just, I just need to hear what you could, do. Okay. Thank you.
Were we clear that it was transportation when an individual is in the vehicle versus
Yeah.
individuals not in the vehicle? Okay.
Uh,
Because that would be an important distinction, just to let you know.
so sorry if I'm talking a lot, committee members, feel free to say, give me thumbs up or thumbs down, but this is what I usually see. Definitely direct hit when an individual is in the vehicle, it's part of the service, right? So that
Yep.
is a definite. But
Yep.
say I am a nurse and I am driving to a residential home to do an on-site review, that's part of a program cost, although the individual isn't in the vehicle. So we might need to talk about what that looks like versus if I'm, driving to a conference center to do a huge training, that's,
Yep. Okay. Yep.
but that definitely wouldn't be, well, it typically wouldn't be specialized transportation.
we will continue to work on that. All right. Right now for PTO, and this, I haven't changed the name of the tab yet. So this is the same, I guess, paid time off section that we'd had on the previous survey of just the estimated average hours of paid time off for different levels of staff for the vacation, sick days, and holidays. And as we next month kind of talk through methodology, this is a piece of kind of one of the components that we look at is the PTO, because it's time that DSPs are paid for that's not billable. And so we want to account for it in a rate. So this is just kind of where we're sitting here. This comment over here, to me, I'm now going to go over to the productivity tab, which also should look kind of similar. So productivity wise, this is training hours, billable hours, and turnover of staff. So once again, training hours, time that a DSP is paid for, but not part of billable service. And so these are the same questions that we had on the previous survey. Training hours in first year of employment, training hours in subsequent years of employment. We use the turnover information when we're looking at training hours, because if you have really high turnover, you're going to have more hours, the training hours for first year employment than you do for subsequent. So we take that into account. And then we also had additional questions regarding additional training hours for DSPs that are working with individuals with high behavioral needs and or high medical needs. So this is information, no changes have been made to these questions as of right now versus what we had done in 2022. Still planning to get that information. The billable hours section, this one is revised, new, but revised. So on the previous survey, we had all of those individual service specific worksheets. And a section of those service specific worksheets was around kind of non-billable time. And we had gone into a lot of detail, and we had asked about transportation hours and meetings and no-shows. And we really got down into the minutia of that. Right now, what we're proposing is just having you kind of tell us what are the average weekly hours worked per DSP for each service. So do they work 40 hours a week? Do they work 36 hours a week on average for your organization? And then what's the expected weekly billable hours for those DSPs? So if they work 36 hours a week, how much are you expecting on average for that to be billable, or kind of what's your reality? So are they normally billing 32 hours a week? So they have an average of 4 hours that they do, documentation, travel that's not billable, different things that kind of happen. So that's what we're looking at right now. So not getting into all of that minutia and the detail of it, just what are those averages? Any questions there? Okay. I'm going to go to the service provision tab. So service provision, this definitely work in progress as far as service provision. This caseload, the number of individuals receiving service during your cost per fiscal year for each of these services. This is a question that we had on each of those specific service worksheets. So we will still kind of ask that question. And then we're in the process of kind of working on service coordination. Service coordination on the previous survey And actually, I'm going to bring that up because I still have all of those handy dandy worksheets. Sorry, I'm going to scroll. And actually, never mind, because I've already made changes to this. Because we weren't sure where we were headed, but we had questions in here, talking about, you know what, I apologize. I'm gonna actually bring up an older version of this, because I really do want to show you what we'd asked. And that's the right there. Okay. I apologize. So we had asked for average caseload of a case manager for individuals identified with a risk management plan versus not identified with a risk management plan, with the understanding that your caseload size for individuals with a risk management plan, the caseload is probably lower for those individuals. And we asked a lot about service design, a lot about hours. Once again, service design for those risk management plans, you know, what are how many do you have? What's the average of hours per plan? Some agencies were able to give us this, some not. We also asked about kind of the different, were there different caseload numbers for somebody who is doing these services versus only having these services? So how did those caseloads look? And you know, we took into account a lot of this as we were working through proposed methodology and kind of working through that. So where we've landed now, and we're still, stop sharing again. It's a new one. Oh, sorry. Okay. And this is just kind of a, hey, this is kind of where we're headed. We'll have a better kind of draft. So I don't necessarily want to get into the wording that's in here right now, because definitely, but kind of where we're headed is still to be able to get, okay, what's the caseload of a service coordinator for individuals? And we're kind of working with the state of, was the risk management plan kind of the right criteria to use for somebody who needs extra time? Or are there other factors that also kind of need to be taken into account for somebody that requires extra time that could fall into that category of having a different size caseload for a service coordinator? So that's just kind of where we're headed, is trying to get at kind of what are some criteria for those individuals that would require more time, and that the caseload might be a different number for those service coordinators, and how to account for that. And that's just part of kind of where we're headed for the for service coordination. And I think I mentioned this last week, but we hadn't looked at any of these worksheets, but we are not planning on having any providers or service specific worksheets. I still have all these worksheets over here in the blue, because I haven't wanted to delete them yet until we get these green worksheets kind of finalized. But the plan is we would not have any of those service specific worksheets. If there's service provision questions for CPS or for supported employment, we'll have a section down here for that service. And so it'll all be on this one worksheet as we move down. So just kind of a heads up. So you won't have, you know, we won't have the macros to hide worksheets, but you won't have 20 extra worksheets there at the back per service going forward. I just haven't deleted them yet.
So I have a feeling you would pop up for that one.
This level of detail, at
Yeah.
least for my agency, is not something that necessarily is tracked
Yeah.
per
Okay.
case manager, per individual.
Okay.
Yes. Do we have behavior plans? Absolutely.
Yeah.
Do we know who has behavior
Yeah.
plans? Yes, we can do that. We would actually have to, I think, read every single one of them to say how many for
Okay.
whichever issue.
Yeah.
But this is the type of stuff, if you're looking to this level of detail, we
Yeah.
need to know ahead of time,
Yeah.
like
Yeah.
way ahead of time, to set up
Yep.
some sort of tracking mechanism. If it's even, and
Yeah.
what you're using it for, again,
Yeah.
because this cost to track to this level.
Yeah.
Okay.
Thank you very
Mhm.
much, Sue.
And I will say, at least from our agency, from a case management standpoint,
Yeah.
it may not mean a different level of individuals that a case manager has. It may depend on the experience of a case manager. So a more experienced case manager may have a, good and bad, folks who need more intense support versus a brand new case manager. So they may have the same caseload size, but it could be just the training and how long someone may have been in a position.
Yeah, and I know when we were talking about caseload and how we were going to utilize it, that turnover, we talked about the turnover when it came to the productivity. It was kind of the same thing on the caseload, that we did look at the turnover information we got for service coordination on the cost reports.
And
So that-
turnover, at least in our agency for case management, has been beyond what we've seen probably in many, many years.
So, okay. Yeah, and this might be one of those, and we'll, definitely, we're talking to BDS weekly, as far as getting through this, but there might be sections, I think we talked about this for the 2022 survey of, there might be sections that your agency or your organization just doesn't have yet, or, doesn't have that. When we talk through the annual cost report and we kind of talk through, okay, what is the expectation for this first year? Especially when it comes to more of the service side questions, kind of, what is the expectation, as far as, can you give us this versus this? And then, when is the expectation that maybe you would have a level of detail, and not necessarily this specifically, but just in general, as we've looked at stuff on the cost report. And that's something that we'll kind of work through, knowing that it's a work in process. The last worksheet is the staffing ratios, and this, once again, work in process. We had the staffing ratios sections on numerous service specific worksheets. So instead of having the different service specific, we'll have one worksheet that kind of for each of the services where we want to understand the ratios and how things are looking. When it comes to the SIS levels, that's also a work in process, right? So we're, continuing to discuss with BDS kind of the same thing that I was just talking about. Like, is this information that we can get right now? Can some organizations get it, but not others? And we really haven't dug into the residential part of
No.
things yet. So that this is like, if there is anything that's really, really draft, it's this. But this is kind of where we're headed with the ratios. If anybody is looking back at that final cost report from 2022 and thinking, oh, hey, yeah, we had to do this. This is kind of that last piece. So there were a lot of other things that we asked for on those service specific worksheets that we're just not planning right now to ask. So this is kind of where we're headed.
So I think, Leslie, that's probably at our capacity for today because this
Yep.
is tough stuff for
Well,
folks. But
we've gotten through all the worksheets, Lori.
yeah,
So
okay, good.
they've at
So
least they've seen everything that's like draft right now. So
right, excellent. So what I want folks to really know, if we could just take this down for now, is that as you can see, this is a work in progress. Your feedback is really important to us. We don't want to get something out that creates confusion for providers. We're going to continue our discussion and adjust our timelines as we need to. So I know that we have a framework at the beginning of our timelines. If we're not ready, we will not be sending it out. Okay. So we'll meet again in August to continue this. And as we've talked about before, which I think is really exciting, we're going to start to review some draft rates.
and I think too, thank you for all of the questions that we got today, because it's also going to help us work with BDS to kind of tailor that conversation next month, as well as to, okay, yeah, we have this part of the cost report. Here's why we were asking that. And once we have a methodology in front of you, that it'll make a lot more sense. So it's really helped me kind of know what questions we need to ask and work towards next month. So thank you.
All right, Leslie, nice job today keeping us all following you. I appreciate it and your patience with all of us as we learn this. So I appreciate your time as well. All right, I hope everyone has a nice weekend. And again, if you think of something when you get off the call, please email us. That's what we're here for. We appreciate your feedback. All right,
Thank you.
bye-bye.
Thank you. Bye.
Thank you.
Thank you.
Bye.